What is chlamydia? Chlamydia is the most frequently reported bacterial sexually transmitted disease in the United States. Epidemiology Part 1. Chlamydia affect both men and women ages 14 through 39. Most people with chlamydia do not have any symptoms and might not even know that they are infected. Chlamydia infections can lead to serious health problems with both short and long-term consequences. If detected early, it can be easily cured with antibiotics. If left untreated, it can cause serious permanent damage to a woman's reproductive system, such as pelvic inflammatory disease, ectopic pregnancy, and infertility. Chlamydia is the most common reportable STD in the United States, with over 1.4 million cases reported in 2013. Infections are usually asymptomatic, and it is estimated that 2.9 million infections occur annually in the U.S. Chlamydia case rates have increased over the last 20 years and reflect increasing screening coverage, expanded use of more sensitive diagnostic tests, and a more complete national reporting. Reported rates are highest among female adolescents and young adults, which is likely a result of the recommendation that females aged 14 to 25 be screened annually for chlamydia. There is no routine screening recommendation for men. Reported cases by age group and sex in the United States in 2015. Rates of reported cases by state, United States, and outlying areas in 2015. Rates of reported cases by sex in the United States from 2000 to 2015. Chlamydia incidence rate in El Paso, Texas, 2015. According to Texas Department of State Health Services, El Paso has 539.3 cases per 100,000 population. Chlamydia incidence rate in Texas. 2015 State of Texas Chlamydia Quick Facts. Number of reported cases, 133,850. Chlamydia rate per 100,000 Texas residents, 487.3. Percent change in chlamydia rate from 2014, plus 0.6%. Transmission of chlamydia. It is known as a silent disease because approximately 3/4 of women do not know they are infected. It can be transmitted during anal, vaginal, or through oral sex. If you touch your eyes with a contaminated hand, you may also develop conjunctivitis. The symptoms occur within 1 to 3 weeks after exposure. Pathology and pathway. The bacterial organism must live inside a host cell to reproduce. Once the infection has entered the white blood cell, it starts to grow and consume the nutrients within it. Then the white blood cell that is infected with the bacterial organism begins to infect other white blood cells. White blood cells infected then rupture and die and release the chlamydia bacteria outside of the cell and gets digested by another healthy white blood cell. Then the cycle repeats. Possible cures and treatment. Chlamydia can be cured by taking antibiotics. The most common ones are azithromycin and doxycycline. Azithromycin is a single dose and doxycycline is taken twice a day for 7 days. According to the CDC, these two have equal effectiveness. The earlier the treatment is given, the lower the risk of any further complications. Following up 3 to 4 weeks prior, the treatment is recommended to retest in case of reinfection. Doctors suggest that you do not share the medicine and they will give you a separate dose for your partner. You should not have sex for 7 days after you have finished your antibiotic treatment. Side effects. Common side effects of azithromycin: nausea, diarrhea, stomachache, and vaginal thrush. Repeated use of a single dose packet medication may cause a second infection. May cause sensitivity to sun, causing the skin to get sunburnt more easily. Blurred vision, dizziness, and lightheadedness. Doxycycline side effects are rash when exposed to too much light, double vision, heartburn, redness, or other discoloration of the skin, abdominal or stomach tenderness, bloating, and dizziness. Where can I get treated and how much is it? Symptoms. Early stages of chlamydia often have no symptoms. Symptoms usually begin to appear 1 to 3 weeks after infection and will be mild and easy to overlook. The white blood cells rush to the urinary tract or genital area and come through the bloodstream to attack infected epithelial cells and eats up the infection, causing swelling and inflammation. Symptoms include painful urination, lower abdominal pain, inflammation. Women, vaginal discharge, painful sexual intercourse, bleeding between periods and after sex. Men, white or watery discharge from the penis, testicular pain or swelling. Cost, availability, and attainability. Chlamydia treatment is likely to get covered by health insurance. Out-of-pocket costs would be a doctor's visit, lab, and prescription drug copays. Those who do not have health insurance still isn't too expensive compared to other treatments. According to Planned Parenthood, the cost ranges from $30 to $180. Also, the price varies with proof of income. Planned Parenthood, which offers sexual and reproductive health services to men and women and has a health center locator. In El Paso, Texas, there are several locations of Planned Parenthood clinics, STD test express locations, City of El Paso Department of Public Health, along with other hospitals and clinics that provide with screening, testing, and treatment. Health concerns. For women, it infects the female reproductive organs such as the vagina, cervix, and fallopian tubes. Pelvic inflammatory disease, ectopic pregnancy. Women who get pregnant can pass it on to their baby when they are giving birth to them, and infertility. In men, it infects the penis, anus, or eye. Swollen and tender testicles. Infection can spread to the epididymis, which is the tube that carries the sperm from the testicles. There are rarely any possibilities of infertility. Pass to newborn. Infants born to a mother who is infected with chlamydia may be at risk for inclusion conjunctivitis, pink eye, or chlamydia pneumonia. There is an estimated 100,000 women who are pregnant that are infected with chlamydia. They are screened at the first parental visit, then again on their third trimester. Chlamydia myths and misconceptions. Knowing you have chlamydia without testing. Fact, most of the time chlamydia has 0 symptoms. Just because it burns during urination doesn't automatically mean you have chlamydia. Fact, it is recommended you get tested because it is a sign of a sexually transmitted disease or a UTI. Get tested only when you have multiple partners. Fact, all young people who are sexually active must get tested regularly. Chlamydia is not curable. Fact, chlamydia can be treated and cured with antibiotics. You can get chlamydia from a toilet seat. Fact, the bacteria cannot survive long outside the body, so it is not possible. Chlamydia final outcome with or without treatment. If untreated, you can develop certain complications. In women, pelvic inflammatory disease, chronic pelvic pain, and tubal pregnancies. In men, urethral infections, swollen and tender testicles. Prevent the spread, practice safe sex.